lot of patients will ask, what is their timeline for breast reconstruction, especially if they have tissue expanders placed at the time of a mastectomy. So I like reviewing that ahead of time so that they know in terms of planning what they need to do and what other surgeries are involved. So at the time of surgery, you're usually recovering for the first 2 weeks. We usually take one of the drains out at the first week post-operative appointment. If you have 2 drains, we take the second one out either at 2 weeks or 3 weeks after surgery. Those first 2 weeks are usually the toughest in terms of discomfort and not moving around as much as you really should be. But with the physical therapy exercises that we have you do, most people get back to normal very soon. So once you hit the 2-week mark with tissue expanders, we usually start expanding the tissue expanders in the office. I put a small needle through the skin. It doesn't hurt because most of that skin is numb from the mastectomy. And I start inflating the tissue expander or tissue expanders if you had bilateral or double mastectomies. So once we reach the size that you want to be, whether it's returning to your original size or the new smaller or larger size that you wish to be, then we usually leave 2 months time between the last time I fill you and the time that we go back to the operating room to switch out the tissue expanders for the final silicone gel implants. Now that is all thrown off a little bit if you need chemotherapy or even radiation therapy after mastectomy. If you need chemotherapy, you likely do that first unless you did it before surgery. And when I say first, I mean you do chemotherapy before radiation therapy. So if you have surgery, you usually do chemotherapy about a month later after your mastectomy. And then that can last anywhere from a few months up to 6, 7, 8 months. That's all dependent on the oncologist and what kind of chemotherapy you need. We can still fill the tissue expanders throughout chemotherapy, but we usually go a little bit slower so we don't stress your breast and your body. Once chemotherapy finishes, if you're not getting radiation therapy, then we usually wait about 6 weeks after chemotherapy finishes for your immune system to get completely back to normal before we switch out the tissue expanders to silicone gel implants. If you do need radiation therapy after chemotherapy, then that usually starts about a month after chemotherapy, and then once radiation therapy finishes, we usually have to wait another 6 months after the end of radiation therapy in order to switch out the implants. So it is a little bit of an extended course, but very few women need radiation therapy after a mastectomy. In terms of when do we do the nipple reconstruction and the areola tattooing, the good thing is that the majority of women can have nipple sparing procedures where we keep the nipple and the areola during surgery. But if your tumor is large or if it was very close to your nipple, sometimes it needs to be removed. If we have to do a nipple reconstruction, we usually do that 3 months after the tissue expander is taken out and exchanged for the implant. Once we do the nipple reconstruction, we usually tattoo the color back onto the areola 3 months after the nipple reconstruction because it needs enough time to heal. One exception to this is if your breast was radiated. If your breast was radiated, I don't perform nipple reconstruction on a radiated breast, and that's because it is fraught with complications and healing problems. And for that reason, what we do is we perform a 3D tattooing, which will give you the appearance of having a nipple with the areola in place.